Chapter 7 Sample Storage. Topic: Temperature and retention time requirements for sample retention. Specimens submitted for clinical biochemistry should be retained for 1 day at 2 to 8 degrees Celsius. Section: Hematology. Specimens submitted for complete blood counts should be retained for 24 hours at 2 to 8 degrees Celsius. Samples for coagulation screening tests should be kept at room temperature for less than 4 hours. Samples for hemoglobin electrophoresis and high performance liquid chromatography should be kept at 2 to 8 degrees Celsius for 1 week or can be kept longer if kept below -20 degrees Celsius. Bone marrow slides can be kept for 5 years. HLA typing cell preparation should be kept for 3 days. Section: Clinical Pathology. Semen morphology slides should be preserved for 1 week. Section: Serology and Microbiology. Serum samples should be retained for 3 days at 2 to 8 degrees Celsius. Specimens submitted for culture should be retained until the final identification and antibiotic susceptibility report is issued. Section: Histopathology. Specimen should be kept for 30 days. Specimen container with remnant tissue in fixative should also be stored for 30 days. Slides and blocks for histopathology should be kept for 10 years. Bone marrow aspirate and corresponding blood film and biopsy should be kept for 5 years. Section: Cytopathology. Fluids can be kept for 24 hours at 2 to 8 degrees Celsius. Slides of the same should be kept for 5 years. Section: Genetics. Blood samples for karyotyping should be kept at 2 to 8 degrees Celsius for 6 days. Extracted DNA should be kept at -20 degrees Celsius for 5 years. Extracted RNA should be kept at -70 degrees Celsius for 5 years. Section: Molecular Studies. Molecular diagnostic gel pictures should be retained for 5 years. Section: Flow cytometry. Lysed, stained samples can be resuspended in buffered formaldehyde solution fixative and stored at 2 to 8 degrees Celsius until analysis. Section: Polymerase chain reaction or PCR. Blood with EDTA should be kept up to 7 days at -20 degrees Celsius or indefinitely at -70 degrees Celsius. RT-PCR specimens, the extracted RNA should be kept indefinitely at -70 degrees Celsius. It is important to note that the laboratory may consider giving the original slides to its patients on specific request for obtaining second opinion or for treatment elsewhere. The laboratory shall have a documented procedure and maintain records of the same. However, attempt should be made to retain at least one representative primary slide on which the diagnosis was based for review during the follow-up. Therefore, to summarize, the suggested sample retention period as defined in NABL 112 has to be followed by all laboratories.